All right, you saw we were having so much fun with Dr. Downie, and we were getting such good answers. These are for you guys, the little online extras. Take it away.
Exactly. One more question. Dave from New Jersey. It's a tout question. Here we go.
Hello, Dr. Downie. My name is David from New Jersey. Just wondering if you can give me some advice on bags under my eyes and dark circles. Thank you.
Oh, this is a little hard. I have the same question, though.
Yeah.
What do you
So
say?
that is my office manager's husband, who I adore. Put me on the spot. The bottom line is that I want to do filler under his eyes because a lot of times your cheek fat pad starts to fall as you get older. And so if you can put some filler right in here, it kind of stops with that deep crease right there.
Do you have to keep doing the fillers though?
Well,
or can you
it's
just
every 10 months or so because you can't move this area that much.
Yeah.
And so it depends. But if the bags are really full, like I love Bill Clinton, but you know his bags were very full at one time, and now he has less. You don't get less as you get older. Obviously, he had a surgery there. You know, that type of thing. But filler would be best for somebody like Dave because he looks a lot younger. I think he's in his mid-30s, and that would help to mask some of that effect. And then we put some back here to do a little light lifting over here. Okay. And then in terms of bags, also men tend to rub their eyes terribly. Women do too, but men in particular, like a Brillo pad or something like that. The more you rub your eyes, the skin is loosening up more. You know, does he wear sunblock there? That type of thing. So and he needs to wear sunblock. He needs to not rub his eyes. But filler we would do underneath there, and that would help a lot.
Well,
so
Dave,
that's
you know
a
where to
great
go
question.
to get it fixed. Right?
This runs in my wife's family, this next question. I'm really, because she's terrified it's going to happen to her. I'm a woman. Why am I losing my hair, and what can I do about it?
Oh, God. So it depends on what age and what they've done. Usually it's over processing. That's the long and the short. I tell people you cannot have a perfect hair day every day, except if you're Audra or JD. But with me, who's a mere mortal, I cannot have a perfect hair day every day. So I tell people, you know what, can the heat. All this flat iron and blow drying, seriously, if your hair's a little frizzy, you're going to live. But if you don't have hair, you might have a more miserable existence. So can some of that. People that perm and color the same day, seriously, there's 2 weeks in between. Come on now.
But
so what if it's easier for your hairdresser?
Is there genetic cause to any hair loss?
It can be your mother's hair thinned at a certain age. It can be hormonal. It can be stress related, loss of a loved one, a sickness, that type of thing. It can be thyroid related. It can be anemia. We do blood tests. We check genetic backgrounds. We do a hair pull test. We do a scalp biopsy in my practice. We see a lot of hair loss. It's always heartbreaking, and it really upsets us. And people that super tight weaves, the super tight, I mean, it's one thing. Weaves are fine, but don't really tightly braid your hair underneath the weave. And definitely no glue at all. And for these people that are putting glue in their scalp, understand that it causes a chemical burn of your scalp, which will lead to an ensuing alopecia even years later. Glue has no part on your scalp at all.
This is why you go to a doctor and not to a spa in the strip mall. Seriously, because you want somebody who knows.
And the spa in the strip mall is going to sell you all kinds of hope in a jar. And you know, the only thing that really works, it's FDA approved for women, is Rogaine 2%, and then they can use the Rogaine for men, which is a 5%. And 50% of people keep what you have, 40% start to regrow, and 10% it doesn't touch. But my patients are very motivated. Using Rogaine twice a day, most of them have very good results with their hair loss, as long as they cease and desist from some of their other activities.
Yeah, that's the key too. Thank you so much.
Thank you, Dr.
You're very
Downie.
welcome.
Go online, you can get more information because you have a lot on your website too. So
I do.
Thank you very much.
ImageDermatology.com. Thank you.